get out. Get rid of that frown that's been dragging you down and get up in the air. Just pretend that you can fly. You'll never know if you can till you try.
Hi, and welcome to Cannabis Helps Dementia. I'm Chella.
I'm Dave. And right up front, we'd like to say that we're not doctors or medical professionals, and nothing you hear in this podcast should be considered medical advice.
Right.
We're not experts, but throughout this podcast series, you'll hear from doctors, nurses, research scientists, administrators, other caregivers, and people living with dementia about how cannabis helps.
Like it did for our family.
That's right.
After my mom was diagnosed with dementia, we were thrust into family caregiving and became fierce advocates for people living with dementia,
Including their access to cannabis medicine. In this episode, we're talking with Kelly Sturgeon, who is the creator and administrator of Creekside Cottage and Creekside Place Assisted Living Homes in Petaluma, California.
And she's also the president and manager of Community Caregivers of Sonoma.
Kelly has created a high standard of care in a home environment that applies 20 years of experience as an administrator, educator, and expert in the eldercare field.
She provides exceptional care through tailored caregiving, meaningful activities, home-cooked meals using local organic ingredients, and using Teepa Snow's positive approach to care.
Kelly is also an advocate for using cannabis for people living with dementia.
Kelly Sturgeon, thank you for joining us and for being on the leading edge of dementia care.
I'm happy to be here. Thank you for having me.
Kelly, your background seems very structured and traditional. How did you become an advocate to incorporate cannabis into your care homes?
Well, in our field, we're presented with some challenges because there are behaviors associated sometimes with people living with dementia that include anxiety, restlessness, sleeplessness, because of the way that Alzheimer's or vascular dementia is changing the brain and affecting their lives. And so we're seeking to reduce suffering and to apply compassion in our work so that our residents are comfortable and living with the highest quality of life possible as we go through this journey with them. And so we discovered the effectiveness of medical cannabis after working with Dr. Jeffrey Hergenrather. And I attended a conference that was sponsored in Sonoma County, sponsored partly by St. Joseph's Health and St. Joseph's Hospice. And I was very, very skeptical going in. I thought, I need to attend this. I want to understand, because the more tools we have available to us to help our residents, the better quality of life that they will have. And I think because of the way Dr. Hergenrather presented his material and the studies that back up the effectiveness of medical cannabis for pain, for mood disorders like depression and anxiety, for sleeplessness at night, among many other things. I didn't realize that it could impact digestion and the GI tract. A lot of elderly residents have issues with GI, and it's a part of aging. Sometimes it's a part of the body slowing down, and so there can be a lot of issues with how people absorb nutrition. And so I didn't realize so many benefits that medical cannabis can have. I didn't know we had a cannabinoid system in our bodies. And
don't worry, most doctors don't know either.
I was so surprised. So that's where it began. It began with Dr. Hergenrather and a group of advocates in our region who were willing to put this conference together. That was a couple of years ago.
Awesome. It sounds like you're talking about the Medical Cannabis Conference. We went to the 2.0 where Dr. Hergenrather gave a wonderful talk, and it was co-sponsored by St. Joseph's Hospice as well.
Must have been number one that
yeah,
you saw.
The first one.
Yeah.
Oh,
you were
okay.
skeptical.
I was skeptical because I hadn't seen studies. I knew that we needed to find alternatives to the medications often prescribed because of the side effects that we've seen with those medications. So we have some residents, we've experienced we've had very positive experiences with psychotropic medications that have been very effective in certain cases, and in other cases where they were not effective and they had very negative side effects. And so then you have to ask, well, what are the alternatives that can help this person who clearly has anxiety, is experiencing quite a bit of confusion, and you're witnessing suffering that you want to help relieve. And so I think that's what led me to go to this conference and find out, is this a good alternative that we can work with Dr. Hergenrather, also Dr. Grobe, who's another physician in the region. And so our journey began, and
Awesome.
we've seen very positive results.
So how and why do you see cannabis helping people living with dementia?
Well, I'll start with sleeplessness. And it's a common problem for people with Alzheimer's because, as we were talking earlier, the brain is changing, and it's not just affecting the memory center, it's affecting many different parts of the brain. And some people experience problems with sleep. We all know that if you don't get a good night's sleep, it's hard to function. And that's for those of us with normal brains. So people with Alzheimer's, they're working with a smaller brain capacity, smaller brain function. And on top of it, to try and function in a world that's confusing to them without getting good quality sleep, that's a lot for them to have to deal with. And so sleeplessness is an important problem to address for people living with dementia. And it's been very effective in helping with sleep at night. Anxiety is another area that we see, people living with this disease exhibiting signs of anxiety. And that can be in many ways that they exhibit anxiety, that we report to their primary care doctors, and that we can work with Dr. Hergenrather or another physician in the field for those who experience anxiety or depression that we see associated with Alzheimer's. And we've seen good effect on these mood disorders.
What about pain? Have you noticed anything with how cannabis relieves pain in people living with dementia?
I'm so glad you asked that. It's such an important part of our work, is to observe for signs of pain and report signs of pain. It can be tricky. Sometimes we feel like, okay, we have to do a little detective work.
Yeah.
Pain can be exhibited or expressed in a lot of different ways. Agitation is one of the primary ways that pain is expressed.
Yes.
There was a study done, now it's probably been over 20 years ago, and I apologize, I can't remember the name of the study.
We'll find it.
It's well known.
And we'll put it in the description.
Okay. And what they looked at is treatment for pain in hospitals post hip surgery for people with dementia versus treatment with psychotropic medications for agitation. And what they found in the study is that if you have dementia and you have hip surgery, you are more likely to be treated with psychotropic medications for agitation post-surgery than you will be treated for pain.
Right.
So we know that agitation is a sign of illness. It's a sign of pain. It's very important that we report that to primary care doctors. And if we're working with, if we're lucky to work with somebody like Dr. Hergenrather or Dr. Grobe, we can report those signs of pain, one of which is agitation, and try to get that resolved with medical cannabis. And there's a lot of different products out there that can help with this. There are topicals, there are tinctures, and different ratios of CBD to THC, depending on the type of pain that's being exhibited. And so I think it's we need more research on this, and it's such a huge need in our field is to treat pain. And there's so many different kinds of pain too. When you think about, there's neurological pain, there's muscular pain, there's psychic pain, and it's very real. And we want to address pain in all of its different forms for people living with this disease.
Can you think of one or two examples that really stuck out in your mind, maybe early on when you started to incorporate cannabis, of patients that really you went, wow, this is really benefiting? And what kind of dosing do you find? You say you're able to use in certain instances rubs for pain, topicals. What are the typical types of products you use, and what kind of a dosing do you usually find in some of these patients?
It's a great question. Thankfully now the dosing is much more reliable. It's clearer in the production of the medical cannabis products, so that because we have to maintain our compliance with regulations for the state of California in terms of how medical cannabis is administered, and follow those regulations in our field, which is important. So thankfully it's really improved. Edibles can sometimes not be reliable in terms of knowing how much accurately, how many milligrams somebody is getting, but they're getting more and more specific about the dosage, and it's much more reliable, thankfully, because often people with dementia are unable in the later stages to take a pill and swallow it.
Yeah.
And so an edible form is going to be needed, whether it's a tincture or a gummy. The topical products that are out there have been very, very effective. We use one that is a combination of CBD and arnica and mint for arthritis pain. Very effective. And arthritis pain can become disabling for people in their as they age if they have arthritis. And think about arthritis of the back or of the neck, which is something that we see quite a bit in our population. Very, very effective and immediate relief that that the product we're currently using.
And that's a CBD, probably a full spectrum CBD, not very high THC, or if anything, right?
Yeah.
Wow.
The product we're using right now doesn't have THC. It's a CBD, arnica, and mint blend.
That's pretty amazing.
It is. So we've used different topicals. It depends on what the physician orders that have been, really effective. And so you're reducing the need for residents to use more traditional pain medications that can have all kinds of issues, especially if they would need to take it frequently, that can have a negative impact on the GI tract. And perhaps even reduce the need for those kinds of pain medications. And we've seen with opioids across the country, the crisis that's happened with opioids for pain management. And while we know our population is under-medicated for pain, it's a given. We know that they're under-medicated. And with the opioid crisis, it's making it more difficult to get pain treated sometimes because of the different regulations and requirements that doctors have to follow. Definitely. And so medical cannabis is a way to effectively treat pain, where we can report signs of pain to the physician and have medical cannabis be a very good alternative to opioids.
And I think that connection between agitation and pain is so important and no one makes that connection really, because, we've seen in our journey in learning with Teepa and that study in particular, we know that study you speak of, an example of the woman who was pulling her hair out, behavior, could not express her pain. And it was a hip pain due to a broken hip that they had not addressed. And once they addressed the pain, that agitation went away, that behavior went away. And then what they do is, like you say, they throw them on psychotropics because they think that's it's a behavior. It's an agitated behavior. It doesn't have anything to do with pain. So that connection is so huge.
Yeah.
And
And the opioids are not allowed to be prescribed to a lot of older people and a lot of people with dementia. We had that problem with our loved one, Evelyn, who was having a serious pain issue, and doctor would only give her Tylenol, and that wasn't doing it.
Because there's nothing really else. I mean, that's it. You've got over-the-counter Tylenols, higher dosages of that, and then they move into opioids, and that's it, really. There's no bridge.
Yeah.
So,
well, medical cannabis definitely gives us so many more options now for this, and I think that's one of the reasons why I'm such an advocate for it. I've seen the impact it's had on residents, and I've seen the impact it's had on the family members who can now have some measure of comfort themselves and seeing their loved one, suffering and maybe not understanding why. There can't be too much education about this link between agitation, restlessness, that we associate with dementia and pain.
Right.
It is a sign of illness. It is not normal to be agitated. Just because you have Alzheimer's or you have vascular dementia, it is not normal to be agitated. That is a sign of illness. And we need to get the medical professionals involved and treat each case uniquely. Now, opioids can have a psychoactive impact on elders, especially. And I think sometimes, I'm not a doctor, I work with doctors, report to them, follow their orders, but I have observed residents who have hallucinations and increased confusion associated with opioids to treat pain. And so then now you have to solve the puzzle of, okay, how do we help a resident who has severe pain? Opioid options are not going to be good for this person because of the side effects. And medical cannabis is an option that we have to us now.
We've heard that the reduction of the psychotropics and other pain medications is definitely a result of using cannabis as sort of a floor and then they make all of the other things work better. Less is needed. Are you finding that to be the case in your settings?
Oh yes.
That's great.
Let's see. We have 4 cases of residents who were admitted on a psychotropic medication. The most common one is Seroquel or quetiapine.
Very familiar.
Yeah. And it can be very, very effective in some cases where there aren't a lot of other options. I've seen an improvement in quality of life with some residents who that's been the medication that was effective for them. But often it can be very sedating. And that poses all kinds of problems for our population. If it has a sedating effect, now you have someone who is taking in fewer liquids, they're eating less, they're sleeping more, they're a higher risk for falling. And so we had a goal of reducing the number of residents who were coming into us on quetiapine or Seroquel, and working with Dr. Hergenrather to reduce the psychotropic medication and introduce medical cannabis. And we did that very effectively with about a third of our population.
Oh, that's exciting. That's awesome.
That's great.
There's a lot of pressure in our field to find alternatives to psychotropic medications.
Exactly.
And yet, if we don't address agitation, we can have a lot of other really serious issues, as in, safety of that resident who's agitated, the safety of other residents that would be affected by a resident who has agitation.
Mhm.
So identifying the underlying cause of that agitation is really important, and what the role that the caregivers play in reporting. The more we can report detailed information to their primary care doctor and to a medical cannabis physician, the better the outcome will be. And so that if we can train caregivers to be very observant about underlying triggers or underlying issues to that agitation, we can identify perhaps what the best approach is going to be.
Which is part of a lot of what you do is you train other caregivers and other facilities on how to implement these positive approaches to care, and also set up cannabis programs, because you are aware of what the state requires, and you do help other facilities set up these programs for cannabis.
Well, what I've done is I've done training with administrators with assisted living education in the past. I haven't had time this past year with everything that's going on.
Sure.
But I have reached out to thousands of administrators who have attended their conferences, and we have talked about medical cannabis in the field in the last few years especially. I think we're seeing more administrators becoming interested in this option and wanting to learn. The more studies we have, clinical trials that we have, that administrators, doctors, nurses can turn to, the better for our residents. We need that credibility. And so I really hope that we see more research papers coming out.
Well, the way to get research papers coming out is to be able to study it. And
Yes.
It's hard to study because cannabis is still on the Schedule 1 of drugs, and there's this big stigma about it. So,
Yeah.
hey, I know you are a oral historian, and I was wondering if you might want to wade into a little bit of the history of cannabis prohibition and how cannabis prohibition is related to structural racism, and how maybe that is related to how disproportionately people of color and women experience dementia, and how cannabis can help.
Wow, that is such a great question.
Just a little bit.
As we wrap up here, give a couple minutes
quick
just to,
thing at the
you can
end.
answer this big structural problem of our day.
Well, when I think of institutional racism and what our country is facing today, I, of course, am just so deeply saddened by the suffering that institutional racism causes. And therefore the need for a movement and a need for people to come together and listen to people who have experienced racism and try to understand what that experience is like, how it's impacted their lives and communities. And I think in really listening and understanding how racism impacts their lives, I would draw an analogy there to dementia and cannabis use, that we set our bias aside and generalizations perhaps that we make about medical cannabis or cannabis, set aside prejudgments and preconceived notions and listen to what is being experienced in the field. Unfortunately, because there isn't a cure for Alzheimer's and vascular dementia as well, there are some treatments that can help with vascular dementia. We are all facing either having a loved one that we will be caring for with the disease, or that we will have it ourselves. And so I think we really do need to listen now to what people are experiencing living with Alzheimer's without a cure, how do we understand the suffering? How do we understand how to help reduce the suffering? And just like with racism, we need to expose bias and set it aside, because it's going to only get in the way and be an obstacle to understanding, which is what we're really trying to seek here, is a better understanding.
Yeah.
Well put. Well connected.
Yeah, we are.
Absolutely.
Yeah, cannabis became the bugaboo that it is over racism. You know, it's it ended up on that Schedule 1 of drugs because of Nixon's racist ideas.
Stopping a whole trend in medicine and studying, and really just put the brakes on trying to find alternatives through plant medicine, many other, not just cannabis, but yeah. So I think you're right. I think having the suffering of people expressing themselves in the streets under police brutality, which is connected to, many arrests, vast majority of the arrests are from cannabis to this day, even in legal states. And ending the drug war is, I think, will benefit not only people who are suffering from under the thumb of police and oppression, but also people living with dementia, because the studies can be done, and we can really get medicine to people, as opposed to just making it, everything's great now because it's adult use and recreational, and it was certainly impacted. It's great that California is regulating, and now we can have standardized dosing available more effectively to folks. Before, it was us. We were a bottle of olive oil infused with cannabis, had no idea really how much was in there. That's what we were working with. And now it has certainly dramatically changed over the last 10 years, certainly since 2018. Those gummies are much easier, but the stigma remains. The education is still required for doctors, for patients, for facilities, for care homes. And it's really great that you are on basically the leading edge of this in Santa Rosa, Northern California, where much of this medicine is being implemented. And there are so few places that do this. We talked to Primrose, and they say he could count on one hand just in that area where this has been implemented. And of course, I think you're in that list. Yeah. How does someone find a place that embraces this medicine? And how do they contact you?
That's a really good question. There isn't a way for family members to choose a facility that works with medical cannabis unless they ask. And I think we have a long way to go there. I think there are people who are progressive out there because we want to make a difference, because we want to relieve suffering. But I think that across the country, it will be difficult for family members to access facilities that are working with medical cannabis. If they themselves can become informed and work with a medical cannabis physician and be an advocate, as you were for your mom, I think right now that's the best approach. And I think residents have the right to be free from pain, to be free from suffering. And they have a right to access a legal medication. The stigma, maybe the younger generation probably is not going to have such a stigma. They're going to be shaking their heads like, yeah, of course I know.
Yeah, where's my cannabis?
Yeah, of course this is going to help. In terms of being in compliance with regulations, thankfully in California, we have clear guidelines, and which is helpful. I don't know what the status is in other states. There are still barriers to this, many barriers to the use of this, and that we're going to need to overcome. And I think those clinical studies will be a big part of helping us get there.
Yep.
I look forward to reading them and following them if they're able to achieve what we need them to and get the funding that they need. I don't know what the status is on the funding. I know it's always an issue.
Sure.
And of course, if with understanding aging and the needs of people in the field of aging, the focus has been on cardiology, and we've come a long way. And if you look at the history of how we understand how the heart works and how long it took for physicians to understand the workings of the heart, and that you could do angioplasty, for example. Those physicians were sort of heretics. They were considered to be not just progressive, but there were a lot of naysayers, let's say, early on, for those who wanted to make breakthroughs on what now is just standard procedures.
Yeah, if you don't have one of those in your, if you don't have a cath lab in your ER, you ain't nothing.
Yeah, so it's standard procedure now. But back when they were trying to break through the barriers to what is now common heart surgery,
standard procedure,
or angioplasty, or standard procedure. So hopefully we'll see that in the field of medical cannabis and neurology, because it's the study of what's going on with brain change, and how THC impacts brain chemistry, and how THC or CBD work with on a cellular level, I guess. And we're going to need some breakthroughs, and there are going to be naysayers. There are going to be those who say, that's crazy. Don't listen to that person. That's not approved. That's not an approved
Even
medication.
just with food. Dilbredazin gets all kinds of problems.
Yeah.
Well, that's another area that your traditional doctors don't get a lot of training in anyway. 2 hours of nutrition, so food always hasn't been big on their list on how to affect change in conditions. So, 20 years, as Teepa said, it takes 20 years for the medical profession to implement a new technology or a new idea.
Yeah,
and Ethan Russo and Grobe and Hergenrather all say that this is a bottom-up movement, that the patients and the caregivers are the ones informing the medical establishment that this works, and we need to do something to help these people, and this works and has never killed anybody, so let's get it on.
The need for medical cannabis and dementia is going to grow tremendously, and even just in the next 10 years we're going to see exponential growth of people living with dementia.
Absolutely.
And I think that we need to speak the truth and understand what impact this is going to have on families, and I see it firsthand every day. So the last trials that were done by major drug companies for Alzheimer's medications, both the largest trials failed, and back to square one for Alzheimer's. And so it's disheartening.
Yeah.
We're
looking forward to the King's College London study of Sativex that should be getting underway this year, but I'm not sure now.
Well, it depends. Well, with the way the things are with COVID, is that you're saying, and everything that's going on in the world. I mean, I'm sure everything in medicine is sort of taken a back burner. I know my sister is a nurse in Colorado, and they are they're losing money. All of the hospitals for the last 3 months have done nothing but COVID, and it's definitely affecting their bottom line. So we need something new in the pipeline. We need some new tools. And everybody we've talked to seems to agree that cannabis is a tool. It's going to be a polypharma world, and we might as well have a nice, natural, relatively harmless tool in that toolkit that can supplement to save money, to get people off of the toxic drugs. So many positive ways you can approach this in talking to people, especially medical professionals and places like, we are looking to reduce suffering and decrease costs. because, and we're with such low doses. I don't know, are you finding that very low dosing is effective in your setting? Because that's what we're hearing, is that super low dosing can be very effective, which makes it much more cost, effective.
Yeah, I think, we're looking at 5 milligrams, which is very low, and with very good effect on pain reduction, or anxiety, or helping with sleep at night.
Mm-hmm.
And we're not seeing negative side effects.
Right.
5 milligrams of 1-to-1 or a THC or a CBD? What do you generally end up using at your facility, or doctors recommend at your facility?
What's been recommended is whole plant whenever possible, like a tincture. That's a whole plant tincture. That is a 1-to-1 or a 2-to-1. But it's interesting. There's a 20-to-1 CBD to THC tincture that has been very, very effective. So you think that's a very, very low, dose of THC, and very effective for sleep, and for anxiety.
Amazing. Yeah, we really do need more studies. It'd be great to know exactly what's what. But for now, we can use what's available and ease suffering for some people.
Yeah. I so appreciate what you're doing, and I wish you luck with your podcast, and I hope this was helpful, and if I
so
can
helpful.
help
This is
other
the least we can do. Where do people find where can they find you to get help, maybe making programs of their own in their own facilities?
Or where, are you accepting more residents at this time? And how do people find your wonderful places up there in Petaluma?
Oh, thank you. You can find us on Facebook under Creekside Cottage, Petaluma. And you can find me on LinkedIn, Kelly Sturgeon. I'm not real active on social media. I don't have a lot of time, but
no.
Dementia. Not a lot of time. Yeah.
But people can. People can reach me via LinkedIn is probably the best way. If an administrator or a caregiver is out there,
great.
They can reach me that way. I'd be happy to point them in a helpful direction if this is something they'd like to start.
Because we really need more. We need more places like you're creating, and the space to in so many ways, with a positive approach to care, the organic foods, and
incorporating Bredeson's protocols. There's nothing like what you have in Southern California.
Nothing at all.
Nothing like
not even close.
Primrose in Southern California. There's no Dr. Hergenrather or Grove in Southern California. It's really you have a very special situation up there.
You do.
It's thank you so much for saying that. It's I think that it's very rewarding work, because we can truly make a difference. It depends on how empowered a team of caregivers is. If you want to be progressive, you need to empower your caregivers, and that's a whole nother podcast topic, because caregivers tend to be overworked and underpaid. I know that's sort of a cliche.
Well, you mentioned underpaid and overworked and underpaid, and where are we seeing this COVID problem? Is a lot of care facilities that are
way
overworked, and their folks are going out and bringing things in, and this seemed to be a trend. But it's
my mom's facility where she died was a major outbreak with multiple deaths and staff all infected.
It breaks my heart. It breaks my heart, because what caregivers need is they need the tools, the training, and the support. And if what we want is good care for loved ones living with this disease, and when the disease progresses, it takes a village to care for someone with Alzheimer's. You can start out with your family members who work so hard to care for their loved one. that as the disease progresses, often you need to grow that village. And and that means bringing in professional caregivers, or placing in an assisted living memory care facility. And so if caregivers are supported and they're cared for, residents will be too. We can't ignore the needs of our caregivers in terms of the supplies that they need, the training that they need, and the support that they need that is ongoing. And it's challenging. There has been a caregiver shortage. There's been a caregiver shortage in California, and I don't know about other states. That has been going on for the last 5 years, 6 years. So it's and now with COVID-19, people are very reluctant to apply for these positions.
It's hard work.
So it's very hard work. It's very
not
rewarding.
well paid.
It's there's a huge need, I think, to focus on caregivers and what caregivers need in terms of pay, of
Living wage
to
start with.
Of access to health care. And it's become very expensive for operators, for us. We've seen our expenses go way up. And of course, now with COVID, groceries are more expensive. Everything's more expensive.
Right.
The core of what we do in memory care and dementia care, the core is our caregiving team. And, back to when we talked about listening, really listening to the needs of people living with this disease. I think we need to listen to the caregivers who are doing this very difficult work.
Who are also often Black and brown.
Yes.
Yep.
Absolutely. And so in terms of empowerment of caregivers through a living wage, through access to healthcare, I think that's an underlying issue that goes to the core of what we do.
Well, there's a lot of priorities.
Medicare for all would change a lot of things.
Yeah, that's for sure.
Yes. I mean, people have asked me,
living wage. That's tough.
I've been asked, why are you for, national health care? You're a business owner, why aren't you more conservative, on that issue? And it's a very easy answer, because I see the impact firsthand with my caregivers and with their needs to have access to healthcare. And, after National Healthcare Reform Act, they started qualifying for premium assistance. And we saw more caregivers get access, to healthcare. As a small business, it is prohibitively expensive for us to carry healthcare. We wish that we could. It would be one of the first things that we would do if we could. But paying a living wage is really where our values are at and where we focus. And
really where they should be. That's the businesses should be paying their people properly, and the healthcare should be not something
Medicare
that people shouldn't worry about. Unions shouldn't have to worry about negotiating for healthcare. They should be negotiating for wages. And healthcare should just be not something that we have to worry about, just like every other other society that's functioning properly.
Yes, absolutely. I mean, I think our average hourly rate is $19 an hour, and we're heading toward $20 an hour. And so, when I hear that caregivers are still making minimum wage, it's how can we sustain that? Really, is that sustainable? Because there's going to only be more of a demand for people who have that head-heart connection as good caregivers, and that is a skill that is very valuable, and we need to value those skills more in our society. And so it's an opportunity for us to become to kind of awaken to the needs of caregiving as a country. And if they're right on what they predict in terms of dementia and the number of people in our country who will be living with it, we will need to be a nation of caregivers.
Yep. The Alzheimer's tsunami will not stop. Yeah, no, this has been super informative from such an amazing facilitator of a home care system that really is where we need to be, where this country needs to be. We need to refocus as opposed to institutionalizing our loved ones that we can't take care of at home because we are so busy and working. Everybody's got to work. The kids got to work. The dog's got to work. Who's going to take care of mom? So we need places like you're creating, and with working with doctors like Dr. Hergenrather, who we've interviewed, and Dr. Grobe.
And Teepa Snow.
Everyone.
And Bill Bredesen.
Yes.
I mean, you're everything I want to be.
Exactly. My sister said, I want to be at Primrose. I think she's going to want to be at your places next. I mean, my sister is a traditional nurse in Colorado. Very excited that I talk about her on the podcast now. But she listens regularly and she is learning so much. And I think the more and more these traditional medical professionals hear the real stories of clinicians and people, administrators that are putting these practices into use in their legal states, their eyes open up and they start to see, wow, this is something we should look at. So I want to thank you for what you're doing up there in Petaluma and for educating and for joining us on Cannabis Helps Dementia and helping us spread the word. And that's really what we found we needed to do after our 10-year journey, was educate people on how this can help and be a tool to help our loved ones and our caregivers, because our caregivers could use a little CBD and maybe a little THC too occasionally, because anxiety and stress is a big killer right now. Chella, anything else you'd like to say?
Just thank you so much for being with us, really, and for all you do for people living with dementia.
Thank you. Thank you, Dave. Thank you, Chella. It's my pleasure.
Awesome. Kelly Sturgeon, thank you. Thank you very much. Keep up the great work.
You too.
Thanks for joining us for Cannabis Helps Dementia. Be sure to download and like us on Spotify, iTunes, or your favorite podcasting network.
And please share this podcast with anyone you know in relationship with dementia.
Do you want to tell your story of how cannabis helps dementia? Visit Anchor FM/Cannabis Helps Dementia to leave us a voice message, or drop us a note and connect with us on the socials.
Check out the Society of Cannabis Clinicians website to find real medical professionals familiar with cannabis medicine in your area.
Because you remember, we're not doctors.
Just family caregivers turned advocates.
And don't forget, download, like, and share what you learn. Cannabis helps dementia.
Why don't you get wise? Get up and get out. Get rid of that frown that's been dragging you down and get up in the air. Just pretend that you can fly. You'll never know if you can till you try. So get out of your rut. Be able and strong. Give vent to that intent you've had pent up for so long. Come on up and see.